I want to thank everybody for carving out time in their day, no matter what part of the world that is. This is our inaugural 2020 panel discussion. It's probably our inaugural 2020 anything, and we're very glad for you to be
Chris.
part of it. This, for those of you who don't know, this is sponsored by the International Society for Systems and Complexity Sciences for Health. That's the organization that is sponsoring it and then under whose gracious auspices we operate. I am your lead flight attendant, Kevin Nortrup. I am principal at Sugar Creek Solutions, and helping me with the moderation duties will be Maria Alessi, who's a PhD program student at UNC Charlotte, and Jessica Moreno, who's a PhD student at George Washington University. They will be monitoring the chat for any comments or questions and bring that to the forefront. The mission, for those of you who aren't familiar with the society, is to improve the health and wellness for everyone around the globe. And we've got a lot of things in our mission statement, but the three that are most pertinent to what we're doing here today is to advocate and facilitate the improved management of complexity in healthcare, specifically health and wellness, through systems thinking, systems science, and complexity science. To encourage and to engage in multi-level big picture thinking, and to foster community and information sharing between individuals, academic and professional disciplines, and schools of thought. That's the reason that we're doing this panel discussion and the series that will continue for. The values that we have include diverse perspectives and inputs from all stakeholders, interdisciplinary exploration, experimentation, iteration, and adaptiveness. Optimization of the overall health system performance, not just of subsystems or of silos, but it all has to be working well. The alignment of incentives with strategic, consensually agreed objectives, that we don't run cross-purpose to ourselves by wanting one thing and setting in motion something else. And most importantly, collaboration and partnership despite divergent visions and missions. And those are all the values that we hope to bring to this panel discussion here, especially this last one, collaboration and partnership, despite divergent visions and missions. Now, for those of you who have been visiting another planet and just got back, we got a thing here called coronavirus 2, or COVID-19 as a disease, and it has been a developing story for the last several months. And developing story is probably a very polite way of putting it. The transmission vectors, the reproduction rate, the mortality rate, the lingering after effects, all those things are discoveries in progress, as we've never seen this thing before, and we're racing to find out what it is after it's already run amok. As a result, containment policies and enforcement are similarly dynamic and highly varied, going from let everyone get it and get herd immunity, quarantine and tracing, shelter in place, all the way to closed borders, closed international borders. Nonetheless, we're still seeing resurging infections and deaths attributed to the disease, and the secondary effects of our attempts to contain it have been disrupting jobs, companies, economies, daily life. It's been, besides the disease itself, there's been a lot of collateral damage. And this has all exacerbated a lot of ongoing, longstanding political and ideological divides. If one looks in the Twitterverse and looks at the flame wars going on, it's very easily divided between those who are sacrificing free enterprise and personal liberty on the altar of fascist socialism versus those who are sacrificing grannies and workers' lives on the altar of selfish capitalism. And both sides claim to be backed by science. So that brings us to today's subject. To mask or not to mask, that is the question. And it's perhaps the most tangible and polarized battlefront, that mandate to wear masks in public. It's just not driven by ideology. The advice from various experts and authorities has been ever-changing, to say the least. We started out being told masks are useless to the general public. Now, they're essential for healthcare workers. We want to make sure they have what they need, but they're useless for the general public. As John Q. Public scratched his or her head and said, I wonder why that is, they were told because the general public wasn't smart enough to wear masks, to use it correctly, or they would get a false sense of security. So that was stage one. Then we started to say, well, maybe masks could be a good idea. It's a good idea. It would be a good adjunct to the importance of maintaining social distance of 2 meters or 6 feet, or if you want to believe other researchers and experts, 6 meters and 20 feet. But then it's become a legal mandate in many places. What kind of mask should we get then? Well, we're going to use the N95, or if you can't get them except from China, the KN95, because those are best at filtering the droplets and particles that carry the virus. Sounds good. Homemade and other masks can be better than nothing. That's not necessarily encouraging, except for those masks that actually may be worse than nothing. And there are some that worry that certain materials actually do a better job diffusing and aerosolizing the droplets and do a better job of propagating than if the person hadn't been masked at all. So it's not hard to understand why this can be hard to understand. So the objectives for our panel discussion is sense making. What the society tries to do is to apply systems thinking, systems science, and complexity science to the issues surrounding COVID-19, masks, public policy, and scientific inquiry itself. When both sides or competing sides claim they're both supported by science, we probably want to look a little closer under the hood. To re-examine the science behind what's going on right now, and then to explore how we might develop actionable consensus on these shared objectives despite divergent mental models on managing the disease and its repercussions. Part of the backdrop that I'd like to suggest as we pursue this sense making is to keep in mind what is called the DIKW model, or as I like to call it, what data wants to be when it grows up. Data, which is just recorded measurements, observations, or something that of that nature has minimal value in a vacuum. When it becomes validated and interpreted within a context, data becomes information. When that information is analyzed for patterns, it becomes knowledge. And when that knowledge is applied to forecasts or decision making, that knowledge becomes wisdom. Now, again, this is just one of several models, but it may be helpful as we pursue what we're talking about in the next hour plus, as we try to make heads or tails out of what the science is behind all this. The process will be very simple. I'll toss a question to the panel. The panelists will each in turn address that question, say 2 or 3 minutes each, and then they'll have a chance for them to kibitz among themselves. We'll have the chat moderators at that point bring forth questions from the Zoom. This is where comments and questions from the audience can be brought forth, and they'll do that for you. And then when we're done, we'll move on to the next question. It's not rocket surgery. But the panelists are a rich array of backgrounds, perspectives, and interests, and I very much appreciate their time here. To begin with, we have Joachim Sternberg, MD, who is an Associate Professor of General Practice at the Newcastle University in Australia. He is Foundation President of the ISSCSH, and his research interests relate to the understanding and management of multimorbidity and systemic failures of the residential aged care sector. Next, we have Jeanette J.J. Bennett, PhD, who is an Associate Professor at UNC Charlotte in the Department of Psychological Science. Her research explores the intersection of biological, psychological, and social influences on the relationship between stress and health. Through her lens, the COVID-19 pandemic is a global stressor, not only for the individual human body, but also for all of humanity's built cultural systems, government, education, and healthcare. Carmel Martin, PhD, MD, is an Australian medical graduate. She trained as a clinical epidemiologist and community physician at the London School of Hygiene and Tropical Medicine, and as a family physician in London, UK. Her interest and experience relate to person-centered care, complex illness, and health systems. She is a complexity science, mixed methods researcher and practitioner who maintains clinical involvement. Paige McDonald, EDD, is an assistant professor of clinical research and leadership at the George Washington University School of Medicine and Health Sciences. She is an educational researcher who has focused on how to integrate technology into health professions, education to achieve pedagogical goals. Paige teaches a course on complexity science and a PhD program on translational health sciences within her school. She remains curious as to how introducing PhD students to complexity sciences influences perspective transformation and approaches to problem exploration and resolution. And of special note for this discussion, Paige is our guinea pig. Paige was diagnosed with COVID-19 in June and is still dealing with the long-term effects of the virus. So I thank everyone on the panel for being willing to participate here. Let's start with the first set of questions here. So question number one, what important perspectives from systems thinking, system science, and complexity science have been absent in our public discussion and policies on COVID-19, its containment, and masks to date? Let's start with Joachim.
Thank you, Kevin. I guess the answer is all of them have been absent. From my way of looking at it, the focus in the public eye, at least, has been only on absolute numbers. And that in itself is exceedingly deceptive because without a denominator, data don't become meaningful. What we really need is an understanding of how all the different observations and experiences we make hang together. That's in essence the basis of system thinking. System sciences is then the methodological way how you explore the things that hang together. If we want to get a true understanding of what COVID-19, the disease, is and how coronavirus number 2 is contributing to it, we need to make that first distinction. Having the virus does not mean you have the disease, and the figures seem to indicate fairly much that COVID is necessary but not sufficient to give you COVID-19, the disease. The majority of people seem to have the virus but not be affected by it. There is a large number of people who are affected who have only mild symptoms that subside. A small number has significant disease with ongoing sequelae, and an even smaller number does do very poorly. If you then see at the next level of aggregation who is affected, it turns out that it is a problem of the elderly. If you think about the elderly in terms of physiology, it means with aging or immune function decreases. If you have underlying other diseases, it's an indication that your immune system is not as good as your peers might be who are not affected by these problems. And it makes, at least on face value, perfect sense to explore the problem in terms of your physiological integrity. How does your immune system, how does your body react to the changing dynamics perturbated by exposure to, in this case, the virus COVID-2.
If you could give a quick wrap up here, Joachim.
Yeah, the question then arises, is preventing exposure to the virus sufficient to prevent the disease to occur from those people who we now know are doing most poorly?
That's an excellent overview. I thank you for that perspective. And what I heard you say is that the systems perspective tells us we need to understand the interrelation and the context, and that's not always what's been going on in the distillation down for the 20-second bite on the evening news. JJ, how about what's your perspective on what's been missing? And building from what Joachim was telling us, what do we need to do to have a better understanding so we can take more realistic action?
Yeah, thank you. I think Joachim did highlight one of the things that stems from the field that I come from, where we understand that the integrity of the immune system is really challenged by a lot of social factors and things that occur outside of the human, right? So their socioeconomic status, the food they put in their bodies, the stress they have, financial strain, you know, all those kind of things. And I think we're seeing that play out. This is why I really, when I watch this kind of unfold in real time, I sat here and go, this is the perfect stressor, a way to observe a stressor for the globe. Not only on the individual, but then as we've now seen our built systems have really struggled with this. And I think that's the piece that strikes me the most. Being in the United States, we had some benefit in that the outbreaks were slower and later in the time course compared to other areas of the globe. And I don't think we actually learned very well in a lot of areas. But we did, if you think about the things that we were able to do, but it was state by state and it was even city by city, right? So there wasn't this concerted, orchestrated, or organized effort in the United States that I think we missed, right? So if we were really thinking in a systems way, we would have been able to take what we were seeing happening elsewhere and really kind of subvert the things that have now gone on to happen here. You know, I'll be honest, I feel like the North Carolina and Charlotte area did a pretty good job at not allowing the outbreak to override the healthcare system here. So we were able to, there was strain, there was stress on the healthcare system, but we didn't see anything like that happen in New York City or things that were happening and very public about Italy, Northern Italy, in their healthcare systems overload, right, where the people weren't even being able to be treated. So I think there was learning, and I think one of the things that was really interesting about this is it was, obviously, as somebody who's sitting here and studying this work for years and just other conditions, that seeing this play out, I wish I could have like made decisions, but I don't have that ability, right? So I'm a academic who talks about theory. So how do you get politicians? So to me, that's the thing right now that we've need to take from this, is recognize we have the knowledge. How do we get it into policy? How do we get it into the people's hands who can actually make the change? And I'm going to stop there for right now, because I think there's been a lot of positives, but there have also been obviously a lot of negatives.
Those are great points. Talking with the social determinants of health, talking about that, as well as the perhaps piecemeal or ad hoc strategy that various regions have done, and the question of how do we take what we had known previously, what we've learned recently, how do we wrap it up and make it actually happen, industrialize it, as we would call it in engineering. How do we make it actually usable and relevant? Carmel, what would you like to say about what we can do to take those things and make them actionable?
Oh, Carmel, you're on mute.
Yes. So I'd like to say what might have been absent firstly. And I think that what has been absent in probably the world is actually is an education and knowledge about systems and dynamics and instability. I think that a lot of our education is based on linear thinking, and that there's an answer, there's a right answer. We will know the answer, the experts will know the answer. And I think what this pandemic has demonstrated is that that basically we were in a situation of possible chaos, and the response has been probe, sense, and respond. And this has been cloaked because of the need to act in public. This has been cloaked in, this is the imperative today, this is the imperative the next day. So there's been changes in imperatives as this probe, sense, and response activity around the world has been carried out, and learning from mistakes. Now that is an absolutely normal way for humans and human systems to work. And yet our media, our lack of understanding of systems and dynamics has created a lot of angst and panic and problems and increased polarization, because our education about systems is so weak. So that's what I want to say has been absent. What has been absent is some expectation that authorities know that people who've got data have answers. Oh, I think you're going to touch this later. And the answers are going to be there. They're a fact, as opposed to they're actually a hypothesis. That's the best we understand at the time. And conveying that has been very problematic, I think. In terms of going forward, I think we have learnt a lot. I think the data science is getting better and better. And the data science, not only on the disease and the medical treatment, also on the social determinants and the impact on society. So we're in a better place to understand what's going on. We can learn from lots of different activities in different countries. And so I think we're in the position to be wiser now. But whether our social systems and our social dynamics will allow that to take place, I'm not sure.
I think the points you bring up, again, have been beautifully additive. This concept of systems literacy, a component that some would argue should be a basic element of even primary education, much less university education, that fundamental understanding of the systemness of things. That's something that would have helped ward off the expectation that experts can fix this, and the discomfort that we have in a chaotic situation. Many have characterized this new world order as VUCA, volatile, uncertain, chaotic, and ambiguous. And we have come to expect from our scientists, from our politicians, from leaders and authorities of all sorts, easy answers and quick fixes. And the probe, sense, respond, which is sensible in a chaotic situation, leaves us feeling somehow we're being shortchanged. So excellent points, thank you. Paige, what would you like to reflect on this?
So I'd really like to reflect on something everyone said, but I think I'm going to stick with my role of being the guinea pig for the individual trying to make sense of all of this. So I want to agree, first of all, with what Carmel said about I think there's a lack of willingness on individuals to be open to the probe, sense, response from the authorities in their systems. Because, going back to what Jeanette was saying about the social determinants of health and looking at health, the psychological fear that we all experience when we see the numbers on the news or when we hear the reports guide our individual sense-making, whether we're going to be open to action or we're going to be closed off to action. And it inhibits when we have multiple sources of information, often that are in competition with themselves, and we don't recognize, and we have no background in systems thinking. How do we then remain open to the fact that this kind of tension is necessary for adaptation and change? Rather, we look for, give me a definitive. So I want the simple rules. I apologize. I want the simple rules by which I can make sense of what's going on around me so I can determine and adapt my behavior accordingly. And the rules are not simple. And the rules change daily, and the guidance changes daily. And we're embedded in not only information systems and education systems, but they're embedded in political systems that are often at odds. So as the individual, I think what is absent in all of course, as an educator, is systems thinking is not in our education system. And therefore, when individuals are trying to make sense of complex situations like this, we don't have tools in our mental models to allow us to think, well, the people who are authorities who are gathering this information need us to understand that things may change as this system is involved, as the situation is evolving. New information may come in that will then change the guidance and the simple rules. And then perhaps individuals, if we had had that type of background, would be more open to the change when it comes and not discount it. I mean, because that's happening within, as a personal experience, that's happening within my own family. I have family members who will not wear masks, no matter what the regulation is, because early on, they heard from authorities in our systems that masks were not essential in this situation. They haven't left themselves, for example, open to the idea that information has now potentially changed, and then the rules by which we need to adapt have changed. So I guess to summarize, I think the ideas and the tenets of adaptation and sense making and being open to learning and change as essential for systems to thrive and adapt, it's not a part of the education that we give to individuals, and so they're not equipped to make sense as things evolve in these complex scenarios.
Great point. I think you've pointed out that that our educational system is finely tuned to prepare people to succeed in the industrial age. And we've not necessarily gotten to the point where we can get that level of success in the information and communications ages, where VUCA, the volatility, uncertainty, chaos, and ambiguity, may be more prevalent. You touched on something else there, which is a beautiful segue to the next question. You talked about discerning between information and misinformation. And how do we account for subjectivity, bias, divergent mental models, divergent worldviews, and between evidence, perceptions, and inferences? I mean, how do we do a thorough and reputable job of distinguishing between the two? Let's start with you, Paige, and we'll work backwards.
So I'm going to go back to what I teach now in this question, because I wasn't necessarily prepared for you to come to me. I think this is, if you go back to the individual and the sense making, it really relies upon the educational level of that and the ability of that individual to discern what is knowledge versus what is information and what is misinformation, which becomes really complex in a scenario such as this. And I don't think we completely understand now all of the factors that would influence an individual's choice to discount evidence that may have be actually information or knowledge that has been generated through reputable sources from disinformation. If that person has never encountered how to make that discernment, then we can't rely upon the individual to make those decisions. And when we are faced with so many different worldviews and often polarized worldviews, we have a political system that is polarizing this in the United States. We have an economic system where we are encouraging that we have to remain open even in situations where it may threaten individuals. We have polarities coming from all different. How should we then, as individuals, make these decisions? And I think it goes back to we're going to rely upon, individuals are going to rely upon the value systems that they operate by and the simple rules that they operate by in their own lives. They're going to trust the authorities that they've come to recognize, whether those are cultural authorities based on religious or other factors, whether those are the news source that he or she's been watching for 20 some years. In absence of being able to discern what is information and what is information. So I guess the last thing that I would point out is this is a knowledge translation problem. For those of us who have discerned knowledge because we have now recognized patterns and the knowledge is coming out and it has been appropriately vetted through the system, it becomes a translation question of how do we translate that for individuals who may not have the educational levels or the exposures that we have had to this type of knowledge in a way so that they can readily discern what is information and what is misinformation.
Great. Thank you very much for that perspective. Sorry if I caught you a little flat.
No, it's okay.
Let's continue backwards here from the previous order. Carmel, what would you say about accounting for the different things that could make it harder to discern between information and misinformation? How do we do a better job of bridging worldviews, of establishing a common denominator when, as Paige pointed out, people tend to hang with the crowd that already agrees with them? They watch the news sources, they talk to the friends, and so how do we break the cycle of reinforcement and actually get some information flowing in both directions between the camps?
Well, I think this is a very difficult problem. And I thank Paige for outlining it. I just take a step back. Not only, I think what's happened is we've gone from the industrial age to the internet age, and the total opening up of communication, where there was some control with experts, and there were limited streams. You know, there used to be a few television channels, everyone would watch everything. Now it's absolutely so diverse, and we've got bad actors playing in the social media. There's, you know, hacking and faking, and so we're in an extremely diverse information world. And I think the only way that we will get better polarization, I don't even know how polarized there's political polarization, but people there's a wide spectrum of views that some people don't even care about the epidemic. They don't care at all. It doesn't touch them. They don't bother. Some people are watching every media release and, you know, doing their data analysis. So there's a big spectrum of people. I think that gradually we need to have, in ways, cohesion, and we need to. I think it is on the authorities, the people who have got access to more power, so knowledge, at least better knowledge and better data, to be more convincing and create more trust. I think there is an onus on those with greater authority and power and access to become more trustworthy. I know that's a very simple answer, but I think we have to start looking at morality and ethics. And I think a lot of that has just gone out the window, the ethics of and responsibility of people in power and authority to be as honest and trustworthy. So I've got no answers. They're just thoughts about having more honesty and transparency in leadership.
I think what you raised there is a fascinating hearken to one of the values or mission that we talked about for the society, that we noted that if the incentives don't line up with the desired behavior, the system is not going to work as intended. And what you've just articulated, in politics, there's sometimes a disincentivization for honesty for a variety of reasons. And so we are getting what we perhaps, we're reaping what we sowed, in that we have incentives that aren't reinforcing the transparency that we need to have to create a greater climate of trust. Thank you very much for that. JJ, what are your thoughts about discerning between information and misinformation?
Well, it's interesting. As I listened to both Paige and Carmel, I think they hit on some really important key topics of things that are going on right now. And then I started wondering, is this really all that new? I don't know if the people who've always had the power have always been honest and trustworthy with their information. So I think what we're just seeing now is that there's more information, and there are more people creating the information that will be utilizing it for their own story or for their own message or propaganda. So it's one of the things that I think is awesome is that I've started seeing on different social media outlets ways to detect fake news, or ways to detect where is this information coming from. And I think even more recently, I think I was posting about this panel, and it had COVID-19 in it. And Facebook asked me, are you sure you really want to post this? You're saying something about COVID-19 in a way that I think it's making people check their awareness about, do I really know the validity of this information? I hope it is. I don't know if that's actually doing anything for the majority of individuals. But back to this idea about subjectivity. I mean, this is psychology, right? 101. This is humans, their experience, whatever that is, will impact their decision about what information they listen to, right? So confirmation bias is a very common thing. And we like to hear someone tell us something that we already believe, right? That is comforting to us. So is it maybe something that it's maybe almost a cultural change that we need to start shifting, is having people be uncomfortable and being okay with uncertainty, right? So I was talking with some family members of mine who we think very differently, and she's like, well, I did start listening to some of the news outlets that you listen to. I was like, oh, you did? Good for you. So that she can kind of check, right? And then we started talking about the importance of hearing all sides of the story, because what will end up happening is you'll probably get the truth somewhere in between, because no media outlet today, or there are very few, let's say, that are really just reporting the story, right? They're all sharing some type of framing of the information to sensationalize, or to get readers, or to do what they need to keep their business going. So I think that's something for us to think about, is how can we, like 100%, I can tell you people who've been directly affected. So obviously Paige, directly affected by this pandemic. Her body challenged, her husband's, her unit, right? They had to deal with it. Her perspective is going to be dramatically different than somebody who lives in rural USA, who there are no COVID cases, no coronavirus cases anywhere in their county that they're aware of, right? That they don't, that's such a disconnect. So it's almost, in my mind, a cultural shift. Can we get people to start to recognize that their reality may not be reality? And I think that's like the go-to question for psychology. Can we do this? Like, I think that's why there's a whole field that dedicates to people and individual differences, right? So I'll stop on that note.
Excellent. Well, thank you very much. And yes, it probably is not new. It's as old as time, or at least as human beings in societies, but the scale may be unprecedented and overwhelming our ability to cope with our shortcomings. Joachim, your thoughts on information versus misinformation?
Well, I guess it goes back to the question, what is information? Information is already a form of aggregation based on smaller units, which we call data. You can use this as creating information and misinformation at the same time. It depends on how you aggregate two diverse data points. I think what is now happening is that we talk about information as if that is a fact in itself, forgetting that it really is a way we have constructed that information. And then goes further on that it exists in a particular frame of thinking. And as has been alluded to by the others, panelists, we are stuck in a way of thinking in a particular frame, which we call our mental model or our worldview. We are connecting what we hear in a way that it fits what we already preconceive. And I think that's where Janet's studies come into. How do people perceive and make sense out of what is around, and how flexible are they to reflecting on their frame of reference? I want to go back to another point which relates more to the system sciences itself. And I think Paige alluded to it. In the end, a system requires a focal point. And as a society, we have not had a discourse on what are the communalities that we want to focus on, what are our core values that drive our interactions. And in the political sense, what is happening is that we have a polarization now very effectively of having only in most countries 2, maybe 3 different ways of constructing society on that particular point. And it's not surprising if you think about a macro system is constituted out of many different subsystems. Each of them, again, has a focus and that within their part of the system, they can create powerful attractors of one way of seeing the world versus another way of seeing the world. What I think is in the end necessary is not to look at the issue, are you right or wrong, which is sort of the evidence debate. In my view, there is no evidence, there is no truth. That's an a priori. What we only can say is how much do we understand the interconnections we see? How much are we able to convey to people that there are interconnections that are affecting each other? And I think that's where the public discourse has failed, not only in relation to COVID, but at the total societal level, where the media have failed, where our politicians have failed. And the question you pose is there a way of getting around it? I think the only way forward is to make evident that things are hanging together and you can't see things in isolation. And the question that arises is, how do these things hang together? And there may be very many different ways of looking at it. And it's a diversity of these views that in the end has the highest potential of seeing, in inverted commas, the true nature of connection. But accepting that the connection still can have dynamic interactions that are not necessarily predictable or perceivable at the time.
So I think that perspective is excellent. From the you talk about the interconnections. I think the first point you hit on is sort of a stop in one's tracks comment that information, if we look at that DIKW model, information is already down selected. There's already some sort of loss or some sort of filter, there's some sort of aggregation by the time it even gets to information. And so I think that's an important perspective to to hold on to as we talk about information versus misinformation. Do we have any callers on the line, chat monitors? Has anything been brought up in the first couple questions that we ought to bring to the panelists here?
Kevin, yes, at least 2 questions I think would be really good following this planned question here. Related then to making evident that interdependence of factors and educating the general public then about complexity. What is the best approach of doing so? How can we better inform the general public about, guarding against reductionist thinking, and in doing so, restore the credibility of science?
Excellent question. Let's toss this up to the panel.
Well, let me start. I think it's a question of having leadership that describes in openness that there are certain things we know, certain things we don't know, and that within that band of known to unknown are certain bits that will become evident as time goes by and things emerge. If you think about it in terms of COVID, it has now become clear that the immune system function is much more important than having the virus. But who has been told that? What is also becoming evident is the fact that your socioeconomic status, your external circumstances matter a great deal on whether you are susceptible to the disease or not. There's the issue of individual cases. If we focus on the individual, which is important for the individual, but may take out of the equation the broader picture of context, then we are failing to see the whole picture. It becomes a question of awareness of these issues that really is a most important factor for moving forward.
So what I'm hearing you say is that we have to start with an awareness and a comfort of a comfort amidst a lack of information, that we have to be comfortable among uncertainty. We have to be willing to forestall certainty and act even in that probe sense respond model that others have talked about. Anybody else on the panel want to address the question of how do we do a better job of preparing our citizens, our voters, or just our students with a better systemic understanding?
I'd like to comment. I think that the fact that older, frailer people with morbidity, people with worse social determinants of health are more vulnerable is something that we know is universal. It's well known, and everybody knows it really in their heart. So that's sort of like human knowledge. We sort of grew up surviving without all this technology and without all this information. As small tribal groups, we knew when people were sick and old and vulnerable. And what has happened is that, firstly, as a society, we've tried to forget about death. We've tried to forget about aging, disability, vulnerability. And this whole, media presentation of everything being glossy, sales pitches. And as a society, I think we have tried to forget that and tried to ignore a lot of this suffering and inequality and vulnerability. And I think I think it goes back to education. I think it goes back, and it perhaps has been a return where people have been affected to more humility, a more simplicity in recognizing the human condition. I mean, you could have predicted the minute that there's a pandemic or an epidemic that the vulnerable people are going to be infected more than the well-off, healthy, mobile, etc. That is something that we all know instinctively, but somehow or other, with all this, we've been overwhelmed by what's in the media with numbers. That's what Arkin's been saying, and we've forgotten our human condition. And I think education and everybody we all need to be more humble and go back to understanding who we are as human beings and our limited lifespans and our expectations of degrees of suffering, and how do we deal with it?
So Paige or JJ, how do we do a better job in our educational system of inculcating both a systemic awareness and a humility and a greater comfort with uncertainty?
Well,
go ahead, JJ. If you have a better or more on your tongue reply, go ahead.
Well, we're the lucky two academics, so who are teaching the next generations. But I think it's a really interesting question because I struggle with this. I keep getting asked this a lot, and I think the last part of that question that was posed to us is, how do we restore credibility of science? And one of the things is I do think as and I'm not sure if it was my predecessors or where in the chain of it, but if you think about the history of the education system and how this developed, I think there has always been we've put physicians and philosophers and educators in a lot of ways in this realm of almost infallible, right? And I think that has come to bite us at this point because we are in a system, we're in a series right now, right? I really don't like this word, and those who know me, we are in an unprecedented time, right? Most of the people on this planet have not seen a pandemic unfold like this, definitely not across the globe, right? So what we're seeing is, and I think what people are recognizing or becoming aware of, is that as much as we want scientists and we want our physicians to know and be certain, the reality is they're not. And I think many scientists would say that, no, I take the information I have and I interpret it. And it's about, and I guess maybe that almost to Carmel's point of being human and recognizing that as scientists and as an educator, I don't know everything. And I tell that to my students all the time. So if we can humanize scientists and we can humanize physicians and we can humanize all these people who we think have to know all the answers, maybe we'd start to realize that in this experience that we've seen unfold and the uncertainty that we've seen and the flip-flops on suggestions about masks, whatever the conspiracy theorists are about why we were flip-flopping, the evidence wasn't there right away. I mean, maybe people can say, well, logically, if it's airborne, masks will help, right? I mean, that does seem like a logical leap, but if you look at scientists who look at the evidence, the evidence wasn't there. Once the evidence started to really show up, okay, now it seems like it's a pretty strong suggestion that it is in some way helping the spread of the virus, right? So I think, I guess really what I'm trying to say is that for educators, if we can help the students who we see recognize that we know some things, but the reality is that this could change the next day. Our reality, I guess that's the part, and maybe we are experts, but we don't know everything. And I guess maybe that's the humble piece, that if we can start to share that, and then the next question would be, can the public handle that we don't have all this certainty, right? And I would tell you, people, if you're honest with them about uncertainty, they can actually handle it. It is better for people to be told it's uncertain than to give a certainty and potentially look like a lie, right? Because then you have distrust, and then you have to rebuild it, right? And those are the things that I think we're at now. Is there's been enough times that we've said something and it ended up not being right, and then people are distrustful, right? So if we could just say we're not certain, but this is what we think is the right thing now. So I don't, Paige, do you have anything you want to add to that?
I'm so glad I let you go first, because that was a really good segue. You know, I think this idea of being able to say you're uncertain relates to one of the things I just said last night. We had our first complexity science course in our PhD program. And the first thing that I said to the students is, in this course, you're going to have to be uncomfortable in the gray. You're going to have to be comfortable in the gray, or you're going to have to get used to being uncomfortable. Because the ways that you've thought about problem solving and the ways that you have learned to learn may not serve you well. So I think that would be my response, because I was trying to think, do I answer this as an educator from a K through 12? Do I answer this as an educator from higher ed and then doctoral level? I think at all levels, the first thing we do is have to teach our learners how to explore problems and the multiple lenses we can adopt to explore problems from all of the scientific disciplines. And what do those lend to us in understanding and coming to know more about the problem before we move into solution mode? And that in and of itself is difficult to learn, because if we are becoming experts in whatever field, we want to have a solution. I know that my physician assistant students come into our program because they want to offer good quality healthcare to individuals who are unwell, who feel unwell, and who come to them. And it's not comfortable to say, I'm not certain. Let's gather some more information. Let's see how we can come to understand what you're going through. And I think that would be my answer, is we have to start teaching and adopting and modeling in our system how we explore our problems and what lenses we're using, and make those transparent, and so that people can then develop their own way of thinking with different perspectives. Going back to what JJ answered with with flexibility and how flexible are people in their thinking and the ways, I think it's can we be flexible in exploring the problem first?
I want to jump on that related to moderating the chat here, because I think this next question really ties those first two questions together. To what extent do you think then that some of the individual differences in responding then to federal guidelines about masking versus not masking, to what extent is that due to a lack of complexity thinking and systems thinking versus the distrust in institutions that people do have increasingly, because we can see that they're not giving us information about immune functioning, for example, that they're not trusting us with that uncertainty? That's a question that comes from Ruben Howden.
Well, I think it relates to the fact that we are talking about experts. If you think about the term, it means you're already reducing your lens with which you focus and think. And in a moving environment, your expertise becomes limited when things change outside of that particular frame. And by being regarded at a social level to be the expert, so you should know, you should be giving me what I want to know or what I need to know, and then it fails. That is where the distrust comes in. It is becoming a question of openness, of saying, this is what we know at this point in time, provide some background to it in terms of, I think that this is based on the fact that these particular parts hang together and interact in a particular way. But we know that things can change if there is if something else is happening. And in this dynamic way, and I agree with Janet, it is unprecedented in the way that most people living on the planet now have never experienced a situation like that. Everyone is learning on the run. But or experts are failing us by not making that apparent and transparent. I think the other part that relates to it is what Kurt has in the chat alluded to, that the so-called experts are not sitting together in one room exchanging their particular experiences and points of understanding what is happening, not exchanging and challenging their mental models, not challenging the limitations of their particular expertise environment, which in fact is reductionist. So they're losing the view on the whole picture.
We have another question from the gallery.
I think it might be good to move on to the next planned question, if that sounds good. We have a few more. We'll try to look for good places to interject.
Excellent. Well, the good news is we're getting lots of good discussion. The bad news, I'm going to have to skip a couple questions here, but I want to put this one up talking about what can science tell us what to do? Can it be indisputably prescriptive about what we should do? I think that's a good one to keep in mind as we address a larger question of knowing the known knowns and the known unknowns. I think Joachim was talking about this earlier. Now, how should we proceed at this time? What are the systemic perspectives on taking all this slurry that's coming at us and functioning intelligently, recognizing this huge gaps in our knowledge, and it's all still a work in progress? Let's start with Carmel.
Oh my goodness, sorry, I was reading the questions.
Oh.
Can someone, sorry, I wasn't just focusing, I was reading the question.
We'll go to JJ. We'll give you a reprieve here. JJ.
So I think this is a really great question. And if we're going to stick with the masks in this point, given that's what we called people here for, at least we sold it that way. I think we have the evidence today that masks are effective at minimizing the spread or the aerosolization of it. And there are papers, I've seen many of them talking about how to increase the efficacy of your mask. And the question is, right, in my mind, right, so we know these work. So I think they should be required. I live in a state where they are required when you're in public. So but I do see lots of people who choose not to wear one, right? I think the evidence is there is all I'm going to say on that. I don't think there's a question anymore about whether masks will help stop the spread of the virus. It doesn't answer who's going to actually develop COVID-19. It's not going to, fix those types of things, but it's definitely going to help us minimize the spread. Now, we can do other things, right, which is social distancing, not getting together in indoor environments to continue to minimize that. And I think those are all wise things to do. And I think they're almost common sense at this point, especially when we're seeing these things. Even if we don't have the hard evidence or the hard data that people like to drive for, we see it, and we can see, there's stories coming out every time when there are big events that get together. There was a super spreader among that group, and now, X amount of people who were there now have it. So I, in my mind, there are knowns, and we know them. Does that then have cascading effects across multiple systems? Is it altering the way we can, instruct students? Yes, it dramatically does change it. But shouldn't we be on the cautious side, in my mind, given that our healthcare system is a limited resource, and we can't overtax it? Because if we do, we're going to be only the people whose immune systems have an appropriate response to the virus are going to be the ones that survive. So I'm just going to stop there. Somebody else.
Are you ready to come up for here now, Carmel?
Yes, I am. Yes, I think that I think I agree with Jeanette. I think the evidence is now clear that social distancing, which includes face masks used by the public, and the social distancing that's recognized generally around the world works. I think that's clear that it works. I think that there's this whole wicked problem about what happens to all the businesses and the young people who's and all the people who've lost work, what happens to them. So that's another domain. But I think the known unknowns in terms of the disease is the impact of especially the people in aged care facilities, the very vulnerable, the frail, the known. We don't know the long-term trajectory of rescuing these people. So you could say, on one hand, we'll only be treating those with a good immune system, and that would be a great inequity to the more vulnerable people. On the other hand, we don't know how much pushing modern medical technology on very vulnerable people actually impacts them in the long term, their actual survival. So I've noticed, looking at the literature, that there are now a number of research protocols for studies to take place to track people, the follow-up. And this goes to Paige's experience, that what are the long-term sequelae of our, very hyper-intense interventions in very vulnerable people and less vulnerable people, and what do we know about how we respond once we've made the diagnosis? So I think that's an area that's unknown. We know how we can cut it down, we can contain spread, but what we're learning about is how we can manage people in different categories who have the disease, and what do we do long term.
So I think your point is excellent there, that there's at least a qualitative sense that the masks, that the social distancing cuts down on the transmission, that there's a diminution of the propagation of the disease, and that sort of presupposes a value proposition that the damage to the economy, the damage to personal liberty and to lifestyles is outweighed by the human cost that is saved by the reduction of the transmission of the disease. Somebody else want to weigh in on this, Paige, since you are first?
Yeah, I do want to weigh in on this because, all I can share is my own experience, and I want to take it back to this question of mask or no mask. So I can share that initially I was traveling in February when we were first starting to gather information about masks, and the messaging was that they would not be helpful. I wore a mask when I traveled because I was going to visit my daughter who had a compromised immune system, and I didn't know enough, right? I didn't know enough to know how likely I was to contract something on an airplane, and I did not want to take something to her. In our family, we followed social distancing guidelines. We kept all guidelines, and we all wore masks when we were around others, except for the people we kept in our closest social circle. We contracted the virus, we believe, because we were in that same social circle, but someone else in that circle had been exposed 2 days before and was not wearing a mask around us. So in our family, it was, if you've gone out and you've been exposed to someone and you don't know where they've been, please wear a mask, because we have 2 people who are immunocompromised in our family. So I can tell you our messaging. And I think this goes back to some of the questions I've been seeing in the chat. Do we have a self or do we have an other focus? And as humans in our family, we belong to the social society, to the society of mankind and to humankind. And it has never necessarily just been about protecting ourselves and that value, and going back to Joachim's language of attractors and common values. It's been how do we also protect others? Because we don't know on any given day when we go into the grocery store who among us might have a compromised immune system. But that focus largely comes because of the discipline in which I work, right? But also it came from, I was influenced by a military background where that's just leadership. You care for everyone, you care for the social system. And I don't know that we have that. And I think we have to have some attractors toward the common good. There has to be some value in all systems, in our systems, the political systems, the economic system, the health system has to share that common value of the greater good and the humankind. And if so, I think our messaging and our symbols will change and we'll get some of those attractors. That would be my response.
Joachim, would you like to close us out on this round real fast?
Yeah, I think what Paige said is really important. What is the common value understanding of society at large? I want to be devil's advocate in terms of not saying masks work or don't work. There certainly is the other perspective that has not been really discussed. What are the other consequences of preventing the spread of, in this case, the virus amongst people who will not be having disease and create the herd immunity necessary to, in the end, protect those people who are vulnerable? Here you see really where values and where connectedness understanding comes to the forefront. That in essence, in the end, you cannot say this is right or this is wrong. I think what Trish Greenhalgh in an editorial in the BMJ said is in the end valid. You should take the precautionary concept into account where there is a high level of uncertainty or where there is a high level of detrimental outcome for, even if it is only for a few in society. So I think you see the common link coming up, that you cannot make these decisions on any other basis as a common value understanding and a common value proposition as a society. And to me, the lack of moving forward is that we have no leadership in any country that really is transparent and open about that question. And it's a question that we have to struggle with on our own for our own way of seeing us and seeing society, as well as doing it as a society at large.
What do we have from the gallery, moderators?
I want to follow up related to this discussion of attractors. Thinking about this from multiple lenses and levels here, what are your recommendations for what might the best, most effective attractors be on, a personal, individual level and larger system level to minimize the impact of COVID?
Panel? Well, I'll salt the mine here, talking about a term that I think Peter Senge liked to throw around, which was shared mental models. That in order to get systemic change to happen in a company or other organization, one of the most important elements is a shared mental model, that people are singing from the same song sheet. And I think one of the issues we see in our society today is there's a lot of different song sheets, and we don't have many shared mental models, or as many as we would help. So what can we do to at least rally around where those diverse mental models at least have some commonality? I think most of us would agree we'd like to live to see tomorrow. If we can agree on that point, despite our mental models, what can we do?
Well, I think the first thing we need to have is an open discussion, making clear to everyone that there are different views. and that these different views are not mutually disagreeable. They're all existing in the sphere of the whole, but we need to create consensus due to discourse. And what has been pointed out in the discussions before is that our social media or way leaders are going about any of their activities is based from a personal bias, self-interest view, whatever that might be, whether it's a corporation to make money, whether that is a political leader to stay in power, whether that is a scientist to say, I've published first and my view now needs to prevail. It is all the same of a closed, self-interested point of view. That needs to become transparent. Only then can it be broken down collectively and something else allowed to emerge out of discourse and reaching a common understanding.
I would like to comment and start from a completely different perspective. I would like to go back to the question of masks. I think despite America having political polarization about masks, which I believe is shifting, I think masks are a very simple intervention. And there are people who, the majority of people seem to feel reasonably comfortable in wearing masks in crowded public places. And that's a very simple, I think, complex systems. If you can agree on something simple, then that is when you can start to form, some degree of cohesion. And I think that masks are probably the one, because masks do not shut down economies. Masks do not kill off businesses. Masks do not keep children out of schools. So something simple like mask wearing, which in some countries in Asia have been used, ubiquitously, and the West, we're starting to get used to the idea. So I think that mask wearing could be an area where, I think is an area around where some consensus is developing, despite the fact that there's diversity and polarization. But something simple like wearing masks doesn't cost a lot of money, doesn't really inconvenience people, and so I think something simple like masks is a good place to start. Now, you can argue that masks may not completely work. Sometimes they're worse than wearing nothing. On the other hand, there are new hypotheses are emerging that they may have added benefits. There's something in a recent New England Journal of Medicine hypothesis, which put as a hypothesis, is that even if we are exposed wearing masks, it may promote, it's like a mini vaccination, and we may actually promote herd immunity by having a very low level circulating in community spread, that people don't get such a big dose of the virus and may not get so ill. So that's just a hypothesis. Anyway, I've just put it out there. I think masks are a simple solution that we might be able to coalesce around.
So I'd like to kind of comment on that. And I agree that it is a simple intervention, but you are asking for behavior change, right? And I think that's where you have to, this is where you get resistance. I know it seems simple, right? I mean, I obviously think it's good, but I do it. But so when you're talking about different, you said, in the East, in like China and places where mask wearing is ubiquitous, it is not a hard thing for them to put a mask on and to treat this just like every other virus that they manage. It's part of their skill set or their toolbox to deal with viral infections, right? But when you're looking at in the West and Europe and in the United States, that is you're asking for people to remember, you're asking them to buy into, because of the way it was polarized, you're asking them to potentially go against groups of people that they've loved all their lives, right? So when you're thinking about behavior change, and this is why psychologists will always have a job, because getting humans to do the right thing for them is very difficult. And even if it may not be the right thing at this moment, but we think it is, it's still hard to help them see or to change or be motivated, right? So we're starting to talk about motivations of people's behaviors and why they do X, Y, and Z. And people spend their whole career studying humans and their motivations. And I have a colleague of mine who studies and looks at these. Her name's Amy Campobello, and she looks at how people approach their interpersonal relationships. So we could apply that to group dynamics in this mask wearing, where you have people who may choose to wear masks, but they're for completely different reasons. Someone might do it because they see themselves as being part of this greater good, as we've been talking about, and this idea that we need to, my well-being is connected to this other person's well-being, therefore I need to wear a mask to protect myself, protect them, protect the whole unit. Another person might choose to wear a mask because they're actually wanting to emit this self-image that I'm part of the group and I want you to think I care about you, even though they don't. They only care about their own self-image, right? So that's why it's hard to get people to change their behavior, because there's no one reason for why a person would opt into mask wearing. And that's part of the problem, right? So if we can figure out what motivates every person, then we would be able to get everyone on board with this simple intervention. And we don't have an answer for that, right? So I think that's where we need to figure that out.
And I go back to the knowledge. So I want to build on that, JJ, because I think behavioral change is so much more complex. And if we have a common attractor, right? If the messaging had been the same, so you're looking at behavioral change at the individual level versus cultural change at the value level, right? And where these two overlap is that value proposition, which relates to your internal motivations, right? So are you internally motivated? Is there a external value proposition that is appealing to your internal motivations? And can we create one set of, Shine talked about cultural change in an organization as taking, if your symbols and your actions don't align with the values that you've espoused, then the rest of the people in the organization aren't going to follow. It's the same thing on a larger systemic level. If we don't have that common attractor and the messaging that masks are essential and everyone needs to wear them, and all of our symbols align with that and all of the actions align with that, then it is easier for people, if we're trying to do individual behavior change, to opt out. It makes it easier for people to opt out. So just because of the variables influencing this system in the United States. I'm just speaking about in the United States.
Well, we have reached the 90-minute mark, and we've barely scratched the surface of this very important topic. I think we've got the line for another 30 minutes. Is that right, JJ? We can run into overtime because the game's tied. So if anybody has to leave now, and some have already dropped off, I want to express appreciation for your patience and your participation. And I hope that you'll be able to check out the website that's under development. It's still a labor of love and ongoing, but we hope that if you haven't been familiar with the society, that you'll be intrigued enough to see a conversation here that you might not find someplace else. So for those who can still stay on, what else do we have from the gallery?
We answered quite a lot there. Thank you so much, everyone, for your questions. This question might circle back to some of our previous conversations about kind of education. Can you speak to what is the role of humility in reaching out to the everyday layperson in disseminating the scientific information and about masks. And that can relate to our topics earlier about building up that credibility of science, perhaps. Do we as experts and educators need to be more humble in the messages, that we are conveying?
Well, I'll start off as moderator and just throw the golden apple into the group here. I think a lack of humility is pervasive in many societies and many parts of many societies. And so whether it's in politics and government, whether it's in science, whether it's in education, whether it's in industry, whether it's in our day-to-day lives, I think a variety of things, and I'm sure JJ can wax eloquent on this. A lot of things bring us to the point where we find ourselves posturing, where we find ourselves painting ourselves as more or different than we are. And so I don't think this is just a scientific or educational problem. I think this is a widespread cultural problem. Let me point the finger at JJ and have her start us off here.
Well, I can tell you that I do think there needs to be greater humility. I think there needs to be greater empathy in our education system. And I'm speaking from the higher ed aspect because that's where I'm at. I think one of the things that can be challenging in that mindset is that often people think that if you have a humble or a way about you that recognizes you're empathetic with your students and the things they're going through, right? Because college students today that I'm seeing in my classroom are very different than the college students just 10 years ago. And with regards to, putting themselves through having potentially children or being military vets at higher rates than typical, at least at my institution. And I think I have a way, and I've been told this, it's not just me thinking this, that I have a way that students recognize I'm available to hear their concerns. And I'm like, but I think it's because I'm a stress researcher and I understand that their lives are very complex beyond my classroom. Even though I want them to solely focus in my classroom, they're not going to because they've got all these other pressing things. So could more faculty develop that? Yes, but we would need to train that, right? Because my training included none of that as a PhD student. Going on for an academic career, I have zero teaching training. So what I learned was from people who taught me as a TA when I was a grad student. So can we do that? Yes, I think wholeheartedly we can change that. But the question is, will we put the emphasis there? Will that be asked for or demanded, right, by the people? And I don't know if that is there, or that I don't even know if anyone knows they need that, right? So
I think you are right, and I think we have to exemplify it ourselves. My teaching with medical students and GP registrars, so guys who want to become family physicians, is just creating an awareness of where do you come from, what do you focus on, and how does that affect not only what you do, but how you do it, and how does it affect the person you are dealing with. If we only think, and that's, I think, the lack of education in today's fragmented world, you become a doctor. So the only thing you need to know about is diseases, but you don't see it in the context. Disease is exceedingly, is uncommon. Most of the people in society do not need a doctor. They are healthy or healthy enough to cope by themselves. If someone becomes a patient seeing a health professional, what is it that made them decide to come to you? Do you understand that? Do you understand the person with the disease rather than solely understanding the nature of the disease? And in a way, in many different contexts, it's a bit of a to and fro. You need to go and see the whole, but at times you also need to see the specifics. Do you have that awareness? Do we as individual teachers, as individual people in society, challenge thinking about the whole versus the specifics? Do we challenge to make the connections between the different parts, how they work together?
I think this traces back also to the question of incentives. That just thinking in the political realm, we have a nice word for it, which is decisive. We want our politicians to jump in the fray with both hands and get something done, and that isn't always in line with humility. And so I think we have set. That this goes back to what we were talking about before in politics and science. We have expected education, all sorts of spheres. We've expected people to have the answer and to do the right thing in response to any particular situation, which requires, if it's not decisiveness, it goes to arrogance. It goes to someone who prematurely closes the door, saying, well, this must be it, and I don't have time to think further, or else I'll look weak or indecisive. So I think we, in some degree, are getting what we asked for by not having a toleration for the uncertainties, for the thoughtfulness, for the vagaries of what the complex modern world demands of us.
It goes one step.
Jump in. Can I jump into that? I want to build on what Kevin was saying. We're getting what we reward. So when we go back to the attractor idea again, our rewards and recognition systems across roles, right? Whether you're in academia, whether you're in politics, whether you're in law, whether you're in the economy, we're rewarded for being experts and to being decisive. And there are recognitions and promotions, and we're not rewarded for being humble and humility. In fact, sometimes it may come as a cost to us, right? Taking that extra time with students, scheduling an out-of-class call with the group just to create a space where they can share the stressors they're going through during this time as they're entering a new system, right? It's at a cost. It's at a personal cost sometimes, and it could even be at a professional cost. And so I think when we start saying that, yes, we need to model, I call myself a humanist constructivist. We need to model the individuals and the values of individuals going into to constructing knowledge and sense-making processes. But we also have to recognize that the systems attractors and in terms of rewards and recognitions don't align with those most times, I think.
If I could come in to support this line of argument, I think we'd pick up what Kevin said earlier, that we've still got industrial factory system models in our society for performance, and that, for example, in aged care, this is what we call it in our country, aged care, people don't have time to talk if they're looking after elderly patients. It's all task orientated, tick boxes. It's doing this, doing that, getting rewarded for that. So because of the industrial age, we've become very piecemeal. Everything has to be contained. There's a limited time frame. It's a factory. We're factories. And we would hope that the information age would have, in a sense, moved us beyond this. And maybe that's one of the positives down the track of this pandemic, is that it exposes the weakness of that industrial model, hopefully. And we will be able to move to a more thoughtful, discursive, humble, human way of behaving.
Well, that's very nicely said, Carmel, because what you describe is what really is going on. We have managers at every level, but we don't have leaders. Leaders are not there to solve problems. Leaders are there to facilitate the necessary adaptive work that people with a problem have to do. Ron Heifetz, psychiatrist by background, working in change management. I think it's such a fascinating way of bringing it down to the nub of what is doable at the thinking level as well as at the acting level.
There was an article in the Harvard Business Review some number of years ago, and the title, paraphrase, I don't remember exactly, is Why Good Managers Are Always Confident But Never Certain. And it was a very interesting comparison of the need to be action-oriented even in the face of uncertainty, to get sufficient information to trigger a reasonable response, and not to forestall indefinitely, to be the paralysis analysis type of thing, but also to, once the trigger is pulled, to say, and I'm open to learning new stuff if I need to pivot, if I need to do something differently. And I think that balance of confident but never certain is a very good balance. It's a good attractor for us to get the best of both worlds, so we don't become indecisive, and we don't have to go for the arrogance. We can get something that's sort of a synthesis between them.
And just to pick up on that, and maybe articulating that there is a level of uncertainty in this action. That's the humility part of it.
We have anything else from the gallery here?
I think that largely answers a lot of the questions that were coming up in the chat. Thank you so much.
Well, we're getting down to about the core people involved here. I will fast forward to the last slide here, which was it's sort of the crux of it. What do we do right? What did we do wrong? And what should we be doing in preparation for the next wave of whatever comes our way, whether it's the next pandemic or some other massive stressor? I've likened COVID-19 to being on a cardiac treadmill stress test. And I think, unfortunately, we as a collective have been pronounced dead and had to have CPR. What do we need to do so we're better conditioned for the next stress test?
I'd like to comment. I don't agree that we've died on the exercise stress test. I think that we've found that that we've got problems. And I think that despite everything, we should have positivity about how we're coming out of this. And I think that all the things we've been talking about, this sort of shift to a systems understanding and more common humanity and humility. I don't know if they're actionable consequences, but I think that we might find that there's been good as well as bad in this whole pandemic.
I'm going to say that oh, go ahead, Joachim. Go ahead.
Can I take up the last point? That I think that's really the most important thing you said. There's probably more good coming out of it simply because the failings of the systems we have become a focal point. And the hope would be that we start to think systemically rather than going back to the shell of taking everything apart and become isolationist.
And I'm going to say that one of the systems that exemplifies what Joachim, you just said, is the higher education system in the United States. We have been increasingly, over decades, dealing with a system that is becoming more and more bureaucratic and more costly. And this environment has forced adaptation and change in all of those systems. And I think that there is going to be more good that comes out. New models of educating, new ways of thinking. It's happening in K through 12 in my own household. And I do think that we're seeing it is highlighting the imperfections and the failings of prior systems. And that's just one example. And I think that changes on the other side, the adaptations that come will be opportunities for learning and change.
I guess I'd like to add that I think as a stress researcher, we always see growth, right? And opportunity for improvement, right? So I see, there's been obviously a lot of issues. And as many people mentioned, we've become acutely aware of places that are failing. I think in the United States, we also have this extra layer of social unrest and recognition that there's built-in racism in our institutions on top of the inability to adapt to a pandemic, right? But we're adapting is what I see happening as we're moving through this. It hasn't been smooth. It's not going to be smooth either. But I really do think there was early on. I mean, I really feel like the scientists that were at the crux of creating the genome for the virus, they didn't hold that to themselves. As soon as they knew it, they shared it with the world. I think the efforts we're making in getting a vaccine right, it's also not a perfect process, because I do think we're moving too quickly, but whatever. It's never going to be perfect. But the idea that we as a society, as a globe, have decided, okay, vaccines are important, and maybe we should invest more money in them. I'm hoping it's not just a blip, a quick injection into that science. But that's been one of those one of the less rewarding fields for pharmaceutical companies and those kinds of things to be engaged in that research and continuing to develop and advance the vaccine science, because it's not profitable. And so if we can figure out how do we keep ourselves on the cutting edge of the vaccine science, that will only help us in our next, obviously, viral or bacterial pandemic. But I think it's something that, as we've seen, the world is adapting. Now, whether it's always good intentions, who cares? It's happening, right? There are things that are positive that have come out of this. Now, I know there's other stories that are coming out now about competition among scientists and having to be first and those kind of things. But early on, I really think this was much more of an effort by the scientific community to really try to work on this. I remember reading stories about physicians in New York City contacting physicians in China who are dealing with this, much longer in their hospital system, and learning from them and realizing, oh, we need to adapt how we're thinking about this. And that was just 2 or 3 months, after it got to moved outside of China. So I think, as much as it seemed like a real mess of a world, I feel like we're coming out of it. And I guess that's probably adaptive humans, right? That's why we're still on the planet and still here, is because we figured out how to adapt. So I don't know. I have hope.
Yeah.
Well, and that's a beautiful note on which to end. Let's not push it further. Let's cling to that hope. I want to thank our panelists and the chat moderators and the overseers, and the couple guests that have a couple attendees that have stuck through to the overtime here. And we're going to get this recording posted on our website at some point, and go to the last slide. Thank you very much for everyone attending. And if you don't know the website, it's pretty easy. www.isscsh.org. And I ask that you all please stay safe and sane during these unusual times. Thank you very much for attending. Australia, have a very good day. And the United States and Canada, please have a good, safe evening.
Thank you.
Thank you.
Thank you, Kevin. Nice job moderating.
Until next time, thank you very much.
Thank you to our students who helped.
Thank you, Paige. It was our pleasure.